Hello everybody, Andrea Tarowski here with Dentalelle Tutoring. This is my first official 30-minute session where if you've been looking on Facebook or if you're a part of my email subscriber list, I talked about this 30-minute session where I've been getting a lot of emails from students, from dental assistants, from dental hygienists who have questions. They have a lot of questions. And I find I'm spending a lot of my time answering those emails, which I love to do, but I seem to get the same questions all the time. Like literally every single day I get similar questions to the week before. So I thought to help you all out, I would have these quick 30-minute videos for you where if you have questions, please feel free to email me anytime, and then I will put those questions together in a webinar. I will post the webinar link as I'm doing now so that you can all see the video, listen to the questions, hear what other people are asking, and then you will also hear me answer the questions, of course, too. And I will link this PowerPoint file to you all also in case you would like a piece of paper of some sort. So you can either print it off, you can take your own notes, or listen. It is completely up to you. You can pretty much use this video however you want. If it's something you would just like to listen to, something you would like to take notes on, print the PowerPoint notes for your reference, whatever is easiest for you, because I would like to have these 30-minute sessions every week. They will be 30 minutes at the most. They might be less, but 30 minutes at the most, just depending on how many questions I have. Now, this week so far, I have had a ton of questions, so I can't go over everything today, but I will keep on going over the questions, though, in my next video. So if you did send me an email and you notice that I didn't answer your question today, then keep on staying tuned in to the videos because I will be posting them every week, answering new or different questions each and every time. So you will all learn a lot, and I do hope that this helps. These videos are pretty much for anybody who wants to listen. So if you're a dental hygiene student, a dental assisting student, if you're a new dental assistant, a new or old dental assistant, a new or old dental hygienist, it doesn't matter. These are designed to help everybody. So a quick background about myself. I am 30 years old as of this video. I've been working in the same dental practice for 11 years. I work as currently a restorative hygienist and a clinical hygienist also. I work part-time because I am also the owner of Dentalelle Tutoring. So I do tutor a lot. I do write courses. I have tons of courses. The most popular course I have is the board exam prep course, where I do help dental assistants and dental hygienists, students, pass the board exam. So it is a full course where I go through the full curriculum with you in PowerPoint, similar to what you will see today, but of course a lot more detailed. And more recently, I'd say the past year or so, I have now the mock exam packages, which people seem to love. So if you wanted to learn more about, let's say, you're studying for the board exam and you don't feel entirely comfortable about oral pathology, well, you can purchase the oral pathology mock exam, which teaches you pretty much everything you need to know about oral pathology, plus multiple choice questions and answers also. So I do have a ton of stuff. I've been tutoring now for 11 years, and as you can probably tell, I love it, which is why I love to hold these 30-minute session videos, because I know that it will help all of you. So today what I want to talk to you guys about actually is I got a lot of questions from people saying, usually new dental hygienists who are saying, I'm going to start working. How does the Perio program work? I know how it's supposed to work in school, how we were taught, but how does it work in the real world? Sorry, my dog Daisy was eating a sock, so I was just kind of checking on her for a second, but she's okay. Where was I? Yes, so students were just asking me, can you explain the Perio process again? How often are we looking for Perio? How often are we seeing patients who are on Perio? So a lot of questions. So let me just scroll down here on the document that I have. So these are the questions that I had, and I'm just going to make this larger for everybody here. There we go. So I had the questions of, how do I know when to book a Perio appointment? So I'm going to start with that first. So this can be tricky for a new dental hygienist, because you're thinking about so much. You're just happy to be able to scale away the plaque and the calculus in 30 minutes, 45 minutes, an hour, however much time you have. But then after the appointment's over, you have to think, okay, when will your next appointment be? And this can be very confusing. Some people say to me, like, I don't know. Do I book them in 3 months? Do I book them in 4 months? Do I book them in 6 months, 9 months, a year? This is the hardest thing for somebody new because A, it depends on the office that you're working. It depends on insurance coverage in some cases, which I hate to say it, but it's true. So first and foremost, what I like to do, I've been working in the same office for 11 years, so I can't really speak from different offices, but what I tell new dental hygienists who start in our practice is to look at the previous appointments and just see how often the patient has been coming in. So if he or she's been coming in every 3 months, his or her next appointment will probably be in 3 months' time. If he's been coming in every 6 months, then it's probably 6 months from now. The only time where things might change is if, let's say you see the patient's been coming in every 9 months, and today there was a lot of plaque, a lot of bleeding, and every 9 months is crazy. You're thinking, every 9 months, this person should be coming every 3 months. There was so much plaque, it took me the full hour, and I had to work hard. That's how you know they should be coming in every 3 months. So even if the hygienist who has been seeing them hasn't talked about coming in every 3 months, or perhaps they have talked about it, but the patient said no 2 years ago, it's something you still need to mention again. Some new dental hygienists are hesitant to do that because they don't want to overstep, but that's crazy because you are a dental hygienist. We all do the same thing. We need to keep the patient's mouth as healthy as possible. So you can't be saying, oh, well, the last hygienist has been having this patient come in every 9 months for the past 10 years. If I say every 3 months, they're not going to be happy with me. The patient's not going to be happy with me. It looks like I'm sort of overstepping. Well, no. You can think whatever you want, but I don't think that's the case because the most important thing is your patient. And perhaps that hygienist wanted the patient to come in every 3 months, but 2 years ago, the patient said no, they want every 9 months, and they just haven't asked since then. So it's something you do need to look into, and you should know when you should be seeing a patient every 3 months, 6 months, or 9 months. So the rule of thumb, and let me see, did I make a note of this in my slides here? No, I didn't. So if I'm going too fast, I apologize, but there's a lot to cover in half an hour, but maybe I'll take more notes for us all next time. So listen up here. So the patient who's coming in every 3 months, they have a lot of plaque, they have a lot of tartar, and there's a lot of bleeding, I guess, is what I'm trying to say. So there's a lot of bleeding. So they should be coming every 3 months because if it's every 6 months, well, you probably have to, scale off that plaque and tartar a lot every single time, right? So 3 months. I see patients every 6 months who, okay, they may have moderate plaque, but fairly light tartar, bleeding here and there, but not really. So every 6 months to me means the patient's oral hygiene's okay. It could improve, but it's okay. They don't have like 4 millimeter pockets, like 5 millimeter pockets or more. Things are fairly healthy. It's just they clearly need to amp up their oral hygiene. And I should move back to 3 months. You should be seeing a patient every 3 months. If their pockets, in my opinion, every hygienist is different. But if their pockets are 5 millimeters or more, if they have a lot of 4 millimeter pockets, then yes, I may say every 3 months. Or I might say, okay, we did the probing today. There's some 4 millimeter pockets, more than usual. However, plaque was fairly light, so we'll keep you on every 6 months for now. But by next time, if things haven't improved, then I think you should be coming in to see us every 3 months. So again, it depends on the patient. You start to learn this with experience, but the rule of thumb, even if you have to start somewhere, think about it this way. If the patient has 4 millimeter pockets, they should be coming in every 6 months, maybe every 3 months, depending on plaque and tartar and bleeding. If things are pretty healthy, 9 months seems to be okay. I don't like to see patients every year because even if I hadn't had my teeth cleaned in a year, I probably have a lot of tartar there. Just because I know how to brush and floss, but there's some harder to reach areas. So a year, I'll see my patients every year if they're, let's say they're 85, but they have excellent oral hygiene or not a lot of teeth left. Those people I would see every year. Unfortunately, I would also see the people every year who say to me, I don't have insurance, I can't afford to come more often. There's only so much you can do if a patient says to you, I don't want to come more often or I can't. So those policies, it depends on your office. You might offer them payment plans. You may offer them to pay on assignment if they have insurance, but they can't afford to pay the upfront fees. But I'll save that all for another lesson because I did have a lot of questions on that as well. So I hope that that did answer your first question as, how do I know when to book Perio appointments? First, I'd say look to see how often they have been coming in the past few appointments. If it's every 3 months, 4 months, 6 months, every year, that's a good place to start, and then go from there. If you notice more plaque or tartar than usual, then you might or should say to them, you know what, sir, ma'am, you had more plaque and tartar today. I suggest coming in for your cleanings more often. Plain and simple. For a lot of offices, even if you do change the time of their appointments, or I should say the frequency of their appointments, they might want to send an estimate off to their insurance. And I'll explain this in another webinar too, because I did have a lot of questions on estimates. But to keep things simple, that is used to send something to the insurance to see how much the patient is covered for. You shouldn't be mainly thinking about what the patient's covered for because that doesn't matter. Their health matters first. But in the real world, that's the first thing that patients think about. They don't think per se about their health. They think, oh, okay, well, if you would like me to come in every 3 months for my cleaning, sure, but is it covered? So you might want to send off an estimate, and you would not be the one to do that. It's typically either the main dental assistant or the receptionist who works up front. Again, it depends on the office, but you could also talk about that as well. And you could explain to the patient, I know I said today that I would recommend you coming in every 3 months. If it helps, I can have them send an estimate off to your insurance to see how much is covered. But even if it's not fully covered, this is something that you need. So it kind of shows them you're listening to them and their needs of, okay, is money her main concern? Yes or no? So it does help to develop that sort of trust with the patient. So I hope that helps with the perio appointments. It depends on plaque, tartar, the pocket levels. Check to see how often they have been coming in and go from there. Now, the next question I had was, or is, question number 2. So it says here, the last hygienist had the patient coming every 9 months, but they are bleeding everywhere. Now what? Is it 3 months? So somebody actually sent me this exact question. So this is going back to what I was actually saying earlier. So even if the patient was coming every 3 months and you see their mouth looks horrible and you're thinking to yourself, well, they're coming in every 9 months. There's a lot of plaque, a lot of tartar. The gums are bleeding everywhere. Things look horrible. What do I do? Well, they should be coming every 3 months, and you need to tell them that. You need to tell them you need to be coming in for your appointments every 3 months now. And they could say to you, well, I've been coming here for every, 9 months for 10 years. Why are you changing it up on me now? That's always a tricky thing because you don't want to say, well, the other hygienist maybe forgot to remind you you should be coming every 3 months, or the other hygienist might not have felt it necessary. Who knows? But you should say something like, well, you may have had more plaque and tartar today. Things take time to become worse. Now things are getting worse, and if we don't nip this in the bud now, things will get a lot worse, and you could lose your teeth, things could become sore, you could develop an infection. The possibilities are endless. So, depending on what you want to say and how you want to approach it, but bottom line is if they're bleeding everywhere, 9 months is not enough, and 3 months they need to be coming in. So, good luck with that. Another question is here. I'm a younger dental hygienist. How can people take me seriously? Now, I do completely understand this because when I became a dental hygienist, I was, I believe, 25. And, which isn't crazy young, but that's also not age 30 or 35 or 40, right? So people know you don't have 10 years experience. And unfortunately, a lot of people think, well, the more experience you have, you are a better dental hygienist, which is true because obviously anything you do, the more experience you have, you are going to be awesome, right? But everybody has to start somewhere. We all went to school. We have the same form of training. In fact, the younger hygienists have even more as far as I'm concerned. They may not have the experience, but they have more training. They have been through a heck of a lot more. We just know our stuff. I'm not saying the older ones don't. Of course they do, and they have the experience. But a lot of the problems is in these offices, when a newer hygienist comes in, people don't take her seriously because she's new and she can't have too much experience. So this is tricky. All I can say is just do the best you can. Be as nice as you can to your patients. Have them have a nice time. Answer any questions. If you see that their mouth is not looking so nice, let them know. Explain to them everything you know and how you can help them. Just do as much as you can and stop thinking you're a younger hygienist so people aren't taking you seriously. Yes, it's possible, but just try to look past that and do the best you possibly can. And another question I had was how often to probe. Now, in schools, they probably say every year. In the real world, it's typically every year to every 2 years. It depends on the patient. If I have a patient who has 3 and 2 millimeter pockets, I'll probably probe them every 2 years. Because if I do it every year, is that necessary? Probably not. But if I have a patient that has 6 millimeter pockets, I'm going to make sure to probe every single year so that I can keep an eye on things to see if things are getting better or getting worse. So depends on the patient. And another good rule of thumb is to look in their past probing charts and see how often they have been doing it in the past and then go from there. And somebody had a question about marking the bleeding points. Now, this is different for every office. I do have some charts down here. Where's my mouse? Oh, there it is. I was touching the wrong mouse. There we go. I have my laptop here and my computer, and I was touching the mouse for the computer and wondering why things were not moving. So let me just turn off my computer because now I just turned it on again. There we go. Okay, so some examples of Perio charting. So with the bleeding points, this is kind of a small chart, you guys, so I do apologize, but it will look larger in the PowerPoint file that I will attach with this. So let's say you are doing the probing numbers for, I can't really see here. Is that lingual or buccal? It looks like the buccal. So say you are doing the buccal for quad 1 over to quad 2. So the numbers would be in here. So for your bleeding points, you would either put a red circle around the number that had the bleeding points. So like you would put a circle over here. Or you would simply put a red dot over the numbers, so over here. So that depends on the office. Every office is different and there's no right or wrong way of doing it. Some offices don't even calculate the bleeding points at every probing. Again, there's no right or wrong way of doing it, but of course, in my opinion, if you're probing and you notice bleeding, you should mark that down. But how you mark it down depends on the office. So ask your office, ask all of these questions beforehand. In fact, I did have a lot of questions on a new dental assistant and a new dental hygienist. They're asking me, I'm about to start in a practice. What are the good questions to ask? So we'll be going over that in another webinar also, because there's tons. And that is a perfect example of one of them. Now, and this is just sort of a chart that I had found. It could look something like this, where you put the probing numbers over here for the buccal, probing numbers for the lingual. You probably had something similar to this in school. Some even have a separate line altogether to mark if the gums are bleeding or not. So every kind of chart is slightly different. Just look at the one you have in your office. I'm just going to take some water here. And the chart next to it is not a probing chart per se. It's just sort of showing you how things may look. So it looks like they had marked down all of the amalgam or composite fillings. It looks like they mark them in red, but typically, okay, and it says here in red, so there's a little legend here. The red is the carious or the defective restoration. So that's a lot. When I first saw this, I assumed that the red was just meaning the fillings that are present, but this is actually saying that it means the cavities or the defective restorations. I hope not. So I hope that this is just a sample, because that would be crazy. Because typically for charting, anything in blue are things that are already there. So think like silver fillings, amalgam fillings, crowns, bridges, root canals, things like that. But red typically means a cavity or something that needs to be taken care of. So if a tooth needs to be extracted, if there's a cavity around a filling, you know, things like that. But more about charting in another webinar also, because I did have a lot of questions. So for new grads, so I talked about that a lot already, just the main things you should know, as silly as it sounds, but every dental office is different. Ask questions. Don't be afraid to ask questions. You should arrive a half an hour early before your first shift if you can help it. Or if you can, because some offices actually aren't open half an hour early, but if you can, arrive early because you will have questions. Ask who you can talk to if you have questions, because if you're working in a larger office with, say, 10 assistants, 10 dental hygienists, 6 or 7 doctors, you may not know who to ask, and certain people you may not be able to ask because they're doing something else, right? So just kind of figure out who you can talk to, who you can ask questions to, and make sure to ask questions. Next slide here. So for the Pareo program, some offices have them, some offices don't. And all this pretty much means is that some offices, as soon as they see a 4mm pocket, that means, this patient needs to be coming in more often. We need to take a whole appointment to talk to them about how they need to improve their oral health. We need to show them x-rays. We need to give them a new toothbrush. So it depends on your office how this program works. In my office, for the doctor who I work for, things are, pretty simple and to the point. If they have a 4mm pocket, we keep an eye on it. We let them know, and I do say, okay, 6 months may be okay, but if things haven't improved next time, then every 3 months, that's what we have to do. If the patient says, well, too bad, so sad, I want to come in every 6 months, then we make a note of it in the chart and we'll mention it maybe next time or the time after that. And we will keep on asking them, like, so you've heard us say before, you should be coming in every 3 months. It's very important. Even today you had more plaque than usual, there's more tartar, so on and so forth. So even if you tell a patient to come in every 3 months and they say no, okay, they do have the right to say no, but you also have the right and the courtesy. You need to be reminding them every time or every other time they come in, like, just so you know, you still should be coming every 3 months, and things like that. So the program depends on your office. Some offices, even if they see a 5 millimeter pocket, that means they send them to a perio specialist. Some offices, if as soon as they see a 6 or 7 millimeter pocket, they send them to this to the perio specialist to be seen every 3 months, and then they see you every 6 months. So it depends. I can't stress that enough. Depends on the office. Hopefully your office has an office manual of some kind so that you can kind of see what they do in the event of a perio program. Do they have one? Do they not have one? Do they not care? Do they see every patient every 3 months no matter what? So it depends. Next one here. Okay, this is important. So, and this may be tricky to do. So knowing how much to charge for the appointment is tricky for a new hygienist. And you don't have to typically put anything in the computer and sign them out, but you do have to put in your chart how much time you spent on polishing, how much time you had spent on scaling, things like that. So if the appointment's for 1 whole hour and you spent 10 minutes on scaling and 10 minutes on polishing, that's 20 minutes. That's it. And I don't know how anybody can scale in 10 minutes. I can't do a whole mouth in 10 minutes, but anyways. So you need to charge according to your time. And if you're not sure, the same rule of thumb applies. Look at the last appointment and see how much how much money to charge for their time, and then how much time they spent on polishing and scaling, and then you should be doing something similar. After you have experience and you've been in a practice for years, this becomes a lot easier. But if you're not sure, just look at the previous appointment and that should help. I know that some offices seem to charge like half a unit of polish and 3 units of scale all the time. Some charge a full unit of polish, a full unit of scale, that's it. Some charge a full unit of polish, 2.5 units of scale. So it depends on the office. And that's another good question to ask also. But the main thing to think about is if the appointment is, let's say, half an hour, you have to think, well, how much scaling am I doing? How much polishing am I doing in half an hour? So if you charge, say, half an hour worth of scaling and 10 minutes worth of polishing, that's more than half an hour, so that doesn't add up. So things need to add up also. Okay, so last slide here is just pretty much, so if I didn't get through everybody's questions today, which I probably didn't, and I do apologize because I did have a ton, which is awesome. But if I didn't get a chance to answer your question, please just send me an email at the address right here, andrea@dentalelle.com. And I will try to do these videos every single week so that I am able to answer everybody's questions per week. It may take me 2 weeks or maybe even 3 to answer your questions, but I will answer every single question, I promise. Okay, so if you have a question, or if you're thinking, okay, Andrea, I had a lot of questions, I just want to make sure you didn't forget, then feel free to send me another email just to let me know. Okay, so I hope that this helped. If you have any immediate questions, I'll be putting this link on Facebook in probably about 10 minutes. So if you do have any immediate questions though, feel free to leave a comment and then I would be happy to answer you as soon as possible. So have a good, what's the day today? Have a good Monday, everybody, and I will see you all next week. I don't know when I'll be doing the webinars, either the Monday, Tuesday, Wednesday, it could be a Saturday, I don't know. It truly depends on when I have the time. And for those of you who know me, I'm tutoring I'm working in the dental office, I'm doing this, I'm doing that, so I am doing a lot. So it just truly depends on when I do have a good half an hour where I can just kind of sit down and answer questions. So stay tuned. I will be posting these on Facebook every single week in my group, or I think it's a page. I don't know if it's a group. Dentalelle Tutoring. So if you would like to have a look at that, then feel free to do so. And I will see you all next week for the next video.